as Sandra said, I'm Mary Hale. I'm the Behavioral Health Director for the county. I also serve in the role of Alcohol Drug Administrator for the county. And so in that role, in those roles, I just want to tell you how overwhelmed, I think, honestly, we all are with the turnout. A number of us have been involved with mental health, alcohol, drug for a long time. We have some members of our Alcohol Drug Advisory Board here, and we don't get turnout like this for those meetings. So thank you very much for being here. Clearly we're here today to talk about the opioid crisis. You're here so you know what a huge problem this is. It's a huge problem for the nation, but also for the state and certainly for our county. It goes across socioeconomic status. Doesn't matter your race or ethnicity. It's impacting all of us. And I know, because there are many people here in the room that I personally know, but there are others that I don't know, that I can imagine this crisis, and many folks are calling it an epidemic, has touched many of you personally. Either you yourselves have struggled with opioid dependence or addiction or abuse. Others have had family members that have or are. And then I know there are lots of you that are sitting in this room that have actually lost family members and loved ones due to this crisis. We get how important it is. And because of that, we at the Healthcare Agency, together with the Alcohol Drug Advisory Board, wanted to really figure out what is it that we need to do for our county. So our goal ultimately is to come up with a strategic plan, not just that'll be a piece of paper that'll sit on somebody's desk, but that will actually help guide us to what we need to do here in Orange County to help those that are struggling, to make sure that we don't continue to lose more individuals. There are lots of reasons for why this has happened. Today at the meeting you're going to hear some data, not so much on the whys, but just details on what's happening in our county, specifically around overdose and death as it relates to opioids. But you're also going to hear some of the first steps that we've taken to try and come up with that plan. Sandra, who came up first, is going to talk to you about some activities that the Alcohol Drug Advisory Board and she have been working on, some surveys where they have asked people that are users, either current users or past users, what do they think that we need to do? Because as is the case with so much, the best source is to go to those people that are actually having that lived experience. We also talked to family members and we've talked to treatment providers. And Sandra, again, will share that information with you. Dr. Condon will talk about the data, as I said. And then you'll also, most importantly, you all will have a chance. Sandra talked about if you want to fill out a comment card, please do so, especially if you haven't already completed one of our surveys. We want to hear from you. We want to hear what you think we need to do. As the healthcare agency, we're the entity that's really responsible for all of the treatment and prevention activities that go on in the county that are funded publicly. So whether it's our federal dollars or our state dollars or our local dollars, we want to put them to good use. We want anyone who needs treatment to get treatment. We want to prevent all of those overdoses, all of those deaths. And we need to hear from you as to what we can do to make that happen. So I welcome you. Thank you for being here. I hope you are able to learn from those things that are shared. I wanted to introduce our next speaker, Geoff Henderson. Geoff is the current president of our Alcohol and Drug Advisory Board, and Geoff will talk to you a little bit about their role, but I did want to say that it's a very important function. And so those of you that are on the Alcohol and Drug Advisory Board, thank you. Thank you for giving your personal time, not just for today, but every month, every meeting, in between meetings. when you are really looking at what those issues are. And by our bylaws, your role is to advise me as the alcohol drug administrator and our county board of supervisors on what we should be doing. And certainly as it relates to this opioid crisis, you have really dug in. I want to specifically, I'm going to look at my notes because I really want to thank the opioid work group. It's the entire Alcohol Drug Advisory Board that has been looking at this, but in particular, Geoff Henderson, Lorraine Martinez, Margie Fleitman, and Lorene Slavinsky. I'm not sure, I hope I said that name right. Thank you so much. You all, together with Sandra, have really been the ones. I know there have been times when you meet every single week and are digging into all of this information and trying to come up with the best plan, including having the plan that we do this forum. So to all of you, thank you. And to Geoff, I think you're up next. I'll just be introducing Geoff as he walks up. Geoff, as I said, is the current chair of our Alcohol Drug Advisory Board. He's also a manager with the Orange County Sheriff's Department. But for many years prior to his appointment with the Sheriff's Department, Geoff has been a partner, a provider with the healthcare agency, and a passionate and articulate advocate for all things related, not just to opioids, but to substance use disorders in general. So thank you, Geoff, and it's your turn.
Okay, thank you. Thank you, Mary. Now I'm nervous. I wasn't nervous before, but now I am. I really just wanted to welcome you and give you a little bit of information about who the board is, what our function is, and so forth, so that when we get to this final stage of our conversation today, that we have some avenues, some vehicle to carry what our plan is forward, going forward into the future. So this forum was part of a larger strategy that our Drug and Alcohol Advisory Board designed in terms of trying to get at understanding what the opiate issues are within our county and how we can best work together as a county team and as a community team to be able to address all of the difficult things that are happening in our community. So this forum was probably step 3 or 4 along the way, as well as the surveys, which Sandra is going to be speaking to a little bit pretty soon here this afternoon. So I also want to, before getting into the Alcohol and Drug Advisory Board real quickly, is also to express my appreciation to the work group for all the time that we devoted and all the energies that went into the overall planning, but also the planning for this forum today. If you wouldn't mind, would you want to stand up so people can recognize who you are? So if they see you afterwards, they can say hi and thank you. Sandra Fair, Margie Fleitman, Lorraine Martinez, and Lawrence Levinsky. And of course, Sandra, if people who don't know who Sandra Fair is, and if you've been kind of around our community for any length of time, everybody knows Sandra Fair at one level or another. She's really been a great mentor for us, helper, a quarterback really in this process. So we're really indebted to her energy and enthusiasm and her competence, frankly, to help us kind of get from one step to the next. So we are very appreciative of all your work and leadership, Sandra. The county's Alcohol and Drug Advisory Board is actually an official board that is that reports to the Board of Supervisors. The board itself is charged with advising the county drug and alcohol administrator, Mary Hale, and team, and the Board of Supervisors. And so our role is to advise on policies, programs that are going on in the community, to address any types of community-wide issues, and to make recommendations to the board or suggestions to the board about these topics. So what we do is we get input from others. We bring all that information together. We discuss as a team how we want to go about advising the Board of Supervisors on what they could do, or just educating them about a topic, or making suggestions about future steps. The members both have a professional interest, personal commitment to advocacy, or just a community member. So it's comprised of 15 members altogether. We actually do have a couple of openings, so if anyone's interested in joining the Alcohol and Drug Advisory Board, please visit the county's website for the board. On that website, you will also be able to access all of the minutes from all of our past meetings. You can see all the business agenda that goes on, as well as seeing the future agenda for future meetings. That way, you can be put on notice, if you will, about an issue that you may wish to come and speak to at the board. The board meets generally on a monthly basis. There are variations on that, but the calendar is also on the same website. And I'm going to read the website out, and the reason I'm reading it is because we have actually two different forms of media capturing our event today. We have a video recording going on in the back that will be a production that will be put out for the community later, as well as we have our social media guru people in the front here that are doing a Facebook Live. So we were insisting that we try to reach as many people as we could so that they can in turn reach back to us with information or their input and so forth. So it was important to our board that we use social media as best we can. So anyway, the board's website address is www.ochealthinfo.com/BHS/about/ADAB. So on that site, which you can find pretty readily just on the county's general website, ocgov.com, then you'll find all the details about how to join and when the meetings are, the agendas and minutes and so forth. Some of the responsibilities that we have as a group are to review the alcohol and drug program components for the county plan, so all the various county plans that go into with the organization of county services. Encouraging and educating the public to understand the nature of alcohol and drug abuse problems, so just general countywide. Reviewing the community's alcohol and drug program needs, services, facilities, and special programs. Submitting recommendations and comments to the Board of Supervisors on state program plans and legislation. And establishing liaison relationships with other boards and agencies. So the board really is only as productive, frankly, as it is in the participation that it garners from the community. It meets, like I said, generally monthly on the first Thursday of each month from 9 to 10:30. It's at the Hall of Administration, the county seat. So in Santa Ana, we use the public hearing room. There's two different public hearing rooms there, and we use one of them. So I would invite you all to come and encourage you, maybe not all on the same day, because I'm not sure whether or not we would probably have enough chairs for everybody at once. But frankly, we were very pleased today that you all found this topic to be important enough to take time of your afternoon to come and speak or listen or however it is that what you wanted to get out of our opportunity today. I will say, because I want to move on to the meat of what we're about today, that what we're trying to do here, frankly, is a complex issue, right? It's not something that we can just say, well, let's just go off and do this, and everything's gonna be okay. All the input that we've received so far over the course of almost about a year's worth of planning and activities that we've been doing around this topic have really pointed us in so many different directions all at the same time. And so it's really important that we hear and get as much information from the community as we can. So it's important that if you choose to speak today to provide us some information, it would be recorded, obviously, and also just notes being copiously taken. But at the same time, if you don't choose to speak today, you can choose to compose an email or a letter and send it in. You can come in person to a future board meeting. There are many different ways to have your input heard and included in our county plan. So we are so grateful that you decided to come today. And let me make sure I didn't forget anything. Okay. I'll just say on a personal note, as Mary kind of made mention that, on a personal level, I've been around in the business for a long time. As I'm probably sure most people in this room either have been in the business working or have been affected by it. And so it touches each one of us in such a different way that this is a very important topic for a lot of people, not just in a professional sense, but in a personal sense. The stories that folks have come forward with at our board meetings with sharing about how their families have been touched, lives that have been lost, or other kinds of consequences in their life as a result of addiction or as a result of opiate dependence have been really heartbreaking and inspirational and troubling and everything under the sun. We've gone through a lot of feelings and a lot of thoughts about this along with you. And we just hope that we can play whatever role we can play as a group to be able to help find more solutions. So with that, thank you again for coming, and I'm going to introduce our speaker today for research purposes, Dr. Kurt, what am I saying? Condon, thank you. See, that's the whole nervous thing coming in. Dr. Kurt, he's really the guru when it comes to research having to do with drug and alcohol and a whole bunch of other different topics as well. And so without further ado, I'm going to invite Dr. Kurt to come up and talk about some of the drug overdose deaths data and provide some insight from a data perspective. So thank you so much. Thanks.
Okay, good afternoon. It's a pleasure to be here today, and I just have to at first make some acknowledgments. There's a great team of people that I work with that are responsible for this report, including Donna Myers at the Sheriff Coroner's Office. She's their research analyst, and so we work closely with her. And also my research team, Richard Chuan, Alec Afte, Allison Palace, and then our desktop publishing graphic artist, On Wynn, created this really nice report for us. And hopefully everybody has a copy, or I think we printed about 200 copies, so hopefully you have one in front of you. And also we have handouts. So today I'm going to cover, if you go to the next slide. Oh, is that for me to do? Okay. So last year I was asked by our behavioral health director, Mary Hale, to do an in-depth analysis of the opioid issue in Orange County. We had previously done studies of drug and alcohol-related morbidity and mortality, but she wanted us to dig deeper and find out what's going on with respect to opioids. And so we've completed this report that was released in August of last year. But before I do that, I thought I'd just quickly go over and review some global drug death trends, just to put it in a little bit of a context. Look at U.S. drug trends, drug death trends, drug death trends in California and Orange County, and then more specifically look at opioids in Orange County. Recently we got access to the California Department of Justice Cures data, which is data that tracks opioid and other narcotic prescriptions, and then talk to you about the morbidity in Orange County with respect to the emergency department visits and hospitalizations, and then the mortality data. Okay. So a recent report by the United Nations Office on Drugs and Crime found that the U.S. has the highest drug death rate in the world. America has 4% of the world's population, but we have 27% of the world's drug overdose deaths. That's not a very stat to be very proud of, obviously. In Orange County, our rate, if you converted it to this per million, we would fall at about 161, so we would be right up near the top, under North America. Okay. And then, sorry, this is really hard to see, but if you have the handout, drug overdose deaths have nearly tripled in the U.S. between 1999 and 2014. And the majority of the drug deaths in the U.S. are due to opioids, upwards of 63% of all the deaths in 2015. And then across the U.S., drug overdose deaths have increased significantly between 2010 and 2015. And 30 states had significant increases. So this graph shows the change. Oops. Does this one have a laser pointer? Maybe not. It shows that states like, and that's really hard to read, like West Virginia, New Hampshire had really big increases in their drug overdose deaths. See, actually I have a laser pointer in my other pocket. Whereas I think California is down here. So California enjoys a relatively much lower rate of opioid or drug overdose deaths. So this is a little easier to see. So across the U.S., drug overdose death rate has increased, as I mentioned. Upwards of 52,000 people die each year in the U.S. in 2015. And then some states like West Virginia and New Hampshire have seen dramatic increases. Between 2010 and 2015, California and Orange County actually did not have statistically significant increases in their drug overdose deaths, though. So that's the good news. And this slide just summarizes changes in national opioid deaths across the country between 2005 and 2015. So the darker blue areas show states that had experienced very dramatic increases in opioid deaths, like up in the Northeast, Ohio, West Virginia, New York, whereas California and Orange County's increase during that time was less than 50%. So just in transition then to the next slide, according to the CDC, sales of prescription opioids quadrupled in the U.S. between 1999 and 2014, yet there was no reported increase in pain reported by Americans. Okay. And so our health officer, Dr. Handler, connected us with the Department of Justice, the Controlled Substance Utilization Review and Evaluation, or CURES database. And so we analyzed these data, and we found that almost half of the 4 million prescriptions to OC residents for narcotics in 2015 were for opioid analgesics, which equates to over 1.7 million prescriptions for opioids, primarily hydrocodone, oxycodone. And so if you do the math, the average prescription was for 72 pills, which corresponds to over 122 million pills in a year. So that's enough pills for 40 pills per resident in a year in Orange County. So with the CURES data, we mapped it by the patient's zip code of residence. And so the zip codes with the dark blue have the higher rates. So you have cities like in the South County, you have like Dana Point, Laguna Hills, Laguna Woods, and up into Newport Beach, Costa Mesa, Huntington Beach, other cities that have high rates of opioid prescriptions. So kind of remember this pattern because it's going to become important later. Okay, so talk a little bit about opioid-related emergency department visits and hospitalizations in Orange County. So this is from the report. So the rate of opioid-related ED visits in Orange County had more than doubled between 2005 and 2015, increasing by 141%. Hospitalizations for opioid-related cases also increased by about 9%. Okay. So we found with respect to emergency department visits, an average of 1,500 OC residents were treated in the ED each year. Roughly 6 out of 10 were male, which is about 4,500 people, while about 39% were female. And then over the last 5 years, the number of opioid-related ED visits increased for all age groups, or for both males and females. Sorry, the next slide is more about the age groups. And then in terms of emergency department visits, the overwhelming majority were to non-Hispanic white residents, 78%, followed by Hispanics at 15%, Asian Pacific Islanders at 2%, and African Americans 1%. And with the exception of African Americans, the number of opioid-related ED visits increased for all racial and ethnic groups over that 5-year time period. So this slide shows that the age distribution for opioid-related ED visits in the the 18 to 34-year-olds accounted for more than half of all those treated for opioid overdose. And the highest number in rate for people, young adults 18 to 24 years of age, followed by 25 to 34-year-olds. And teenagers and seniors had much lower rates overall. And the number of opioid-related ED visits increased for all age groups during that 5-year period except for adolescents. So we looked at the geographic distribution, and we found higher rates of ED visits for people who live in South County, for Huntington Beach, Costa Mesa. And what we found, we analyzed this pattern with the prescriptions, and there's a significant correlation between cities that had high rates of, and zip codes that had high rates of prescriptions to those that had high rates of ED visits for opioid overdose. Okay. Okay, then moving on to the opioid-related deaths between 2015 and 2016, or 2015. Actually, we just got the 2016 mortality data from the state, and so I went ahead and added this. And what we see, this is the mortality rate for Orange County in California and in the United States. So California is a blue line. California's mortality rate has increased by 32% since 2006. Orange County has increased by 64%. And the U.S. saw another huge increase in opioid mortality in 2016. So that's not a good trend. It's moving in the wrong direction. So in Orange County, in 2016, there were essentially 300 opioid-related overdose deaths. So if you took California, California would rank the 47th lowest rate of opioid death, so among the lowest in the country. If Orange County were a state, we'd rank 35th. So to put it in a little perspective. And then in terms of the demographics of the overdose victims, the majority were male, 62%, average of about 149 males die each year, and compared to 93 females. And also the corresponding rates are much higher for males compared to females. And if you look at in terms of the race and ethnic background of the overdose victims, the overwhelming majority are non-Hispanic white, 82%, followed by Hispanic at 14%, Asian Pacific Islanders at 3%, and African Americans at 1%. Okay. And then if you look in terms of the age distribution of opioid overdose deaths, the majority, 45%, are between the ages of 45 and 64. Adults 45 to 54 have the highest rate at 13.8 per 100,000, followed by 55 to 64-year-olds. The graphic on the left shows the age distribution. So at younger ages, you tend to see more males overdosing compared to females, and then you get up to in the middle ages, it's more equally distributed between males and females. So prescription opioids account for 55% of all overdose deaths, followed by mixtures of drugs and alcohol at 26%, and illicit opioids such as heroin at 19%. And the most prominent opioids are like natural semi-synthetic opioids such as hydrocodone and morphine. They're about 66% of all the overdose deaths. You also see heroin at 20%, oxycodone at 19%, and codeine is involved in 16% of the cases. Importantly, 81% of the overdose deaths were determined to be accidental, 15% suicide, and in 4% of the cases they could not determine the intent. Oopsie. So this map demonstrates the geographic distribution of the opioid-related deaths during this 5-year period. And again, you kind of see a pattern where you see higher rates down in South County and also in Huntington Beach, Costa Mesa. And overall, the southern region of Orange County experienced the highest increase in the number of deaths, 21% during this 5-year time period. So as I mentioned, we just got the 2016 data from the state, and so I thought we should add it. And the trends are moving in the wrong direction. As you'll note, the top line is ED visits. We saw a sharp increase in ED visits between 2015 and 16. This number is now about 2,300 cases in the emergency room. Hospitalization rate went up pretty markedly. That represents about 1,100 cases. And the mortality rate while it's increased, it hasn't thankfully increased at the same rate as the ED visits or the hospitalizations. So if you do the math, the ED visit rate is now between 2006 and 16 has increased by 215%. So those are pretty sobering statistics, and so I think we have our work cut out for us. So I'll turn it over to Sandra Fair, or if there's any questions, I guess I could try to answer them right now. No? Okay, thank you.
Thank you, Kurt. No, I don't need the pointer, I don't think. Good afternoon. As I mentioned before, I am Sandra Fair. I'm with Behavioral Health Services in the Healthcare Agency. And before I get started, I would like to thank the elected officials who sent representatives here today. We're very pleased to have representatives from Lou Correa's office and also from Tom Daly's office. So thank you. And if there are any more, please let us know so we can acknowledge you. You've just heard the devastating information received, that Kurt provided about what has happened in the nation and what is happening in Orange County. And so getting the data just tells us what happened, what is happening, and now we have to look at what we have to do, because we as a community combined can address this. Many of you probably know the Serenity Prayer, and lately I've heard a new expression come out that kind of turns some of the Serenity Prayer around, and it says, "I will no longer accept the things I cannot change. I will change the things I cannot accept." And certainly the opioid crisis is something we need to change and make go away. The Alcohol and Drug Advisory Board is developing a strategic plan with Behavioral Health Services to identify the individual and community needs and strategies to reduce overdoses and addictions. Today we will be presenting what we've learned, what other strategies are out there, and also hopefully to get input from you on what strategies you believe would be helpful. During the past year, the Alcohol and Drug Board has been getting input from affected stakeholders to learn what the needs are. We then compared those needs to what services are available in the universally accepted areas of addressing the opioid epidemic, which is prevention, harm reduction, treatment, and recovery. And then we looked at gaps and other strategies to meet the need. In order to gather the information, as was mentioned before, we conducted surveys, we did public hearings, the Alcohol and Drug Board did public hearings, we went to opioid events, all opioid events we could find, and we also looked at research materials that are available nationwide. We did targeted surveys, so we wanted to reach the stakeholders we thought were most impacted by this disease. So we looked at current and former opioid users, treatment providers, family and friends of current or previous opioid users, and other community stakeholders. We did receive over 800 responses from all areas of the county, which we were pleased to see because we didn't want to focus on one geographic region. So what I'd like to do now is give you a snapshot of who the respondents were, and particularly the consumer respondents. 326 current or former opioid users responded to the survey request. Most of them were adults. They ranged from 26 to 45 years old. Again, just as are other people that are afflicted by this disease, most were either non-Hispanic white or Hispanic. 56% of the respondents were male. The majority of the respondents spoke English. Only 10% spoke Spanish and 1% spoke Vietnamese. When we asked them how they initially got started with opioids, 50.7% or almost 51% said they initially got opioids from their friends. Another 36.6% got them because they were prescribed to them for either an acute or a chronic ailment. Only 8.1% got them from family members, but that's still very high. Over 81% of the consumer respondents said that they are now totally abstinent, but 11% are still using heroin or opioids. And 96% of the people who used opioids said they used them for over a year at a minimum. So what did they do when they started with opioids? Well, 37% of the respondents started with pills and moved on to heroin. 19% used only pills, and another 19% used only heroin. 11% used fentanyl, which is a frightening statistic. And then the others used other different types of narcotics. When we started looking at their use history and asking questions about overdoses and hospitalizations, the respondents stopped responding. Far fewer of them responded to the questions. But of those responding, 28% of those that responded said they had OD'd at least once. 30% of the opioid users were unaware of naloxone, the drug reversal for overdoses, which is interesting because another 19% had either been revived through the use of naloxone or had actually administered naloxone to someone else. And 29% were treated in emergency departments or hospitals due to an overdose. When we asked what happened when they came out of the hospital, over half of the people who were treated in an ER said that they got no information about getting treatment. They were just simply released. Another 25% were told that they had a problem and they should go get help. The remainder got various levels of referrals or encouragement, and in fact, I believe I read one particular survey response where they said the hospital followed them for quite a long time, and I thought that was really wonderful. With criminal justice involvement, again, there was a low number of responses by the opioid users, but of those responding, 47%, almost 48% said that they had been arrested on drug charges, and of those arrested, 68.4% said they served time in custody for drug charges. 40% of the people that responded, we did ask if they had gone into the court system, the collaborative courts, and 40% of those responding said that they had never participated in drug court. We don't know the linkages that are provided for most people when they're coming out of a custody situation. We do know that there are participants in the AB 109 offender program, and they do have good case management services while they're in and after they leave from jail. But the general population who may be experiencing a drug problem, we're not quite sure how they're getting linked regularly to treatment. So considering treatment, 1 in 4 of the respondents said they'd never had any treatment of any kind. 47% said they had 2 or more episodes of care. And in those episodes of care, they may have gone to different treatment modalities. So people do tend to go to detox services, they may go to residential, they may go from residential to outpatient or vice versa, but they are using the services. 59% were never prescribed any medication-assisted treatment for recovery. But of those who did have medications prescribed to help with their recovery, 23% of them said they were taking their medications appropriately. So that's our consumer population. Our other survey respondents included treatment providers, family members, and other community stakeholders. 302 treatment providers responded to the surveys, and they came from all regions of the county, and they came from a spectrum of professions, from therapists to managers to psychiatrists to volunteers. 80 family members responded to the survey, and primarily it was parents that were responding. 35.9% were parents, followed by siblings and children. Of community stakeholders, there were 95 community stakeholders that included representatives from family services organizations and healthcare professions. There was also 32% that identified as friends and family of those with opioid use disorders. So as we moved forward on the surveys, we asked each of the groups some very specific questions. First, we asked, who is it that needs treatment in Orange County? And we got consistent responses across all groups of the survey. Everyone agrees that young people, people who are chronic pain sufferers, the homeless, people being released from custody, and those with co-occurring mental health disorders are the most in need for treatment services. So then we asked, why aren't they getting treatment? The answers were consistent actually with nationwide surveys and responses, and that is primarily people do not get treatment because of cost or lack of insurance. A lot of people are in denial, or they simply aren't ready to go into recovery, or they don't want services at that time. There is a lot of stigma in the community, both personal and social, and it prevents people from seeking help. A lot of people don't know where to get help, and some are just frustrated by delays in being admitted to treatment. There are long waiting lists for some programs. Interestingly, although the number one response for not getting treatment was the cost or lack of insurance, almost 50% of the consumers responded that they had private insurance. So we asked for the respondents to provide the top 3 services that are needed. And the ones that came out on top were then analyzed. And we compared the responses to the areas of prevention, harm reduction, treatment, and recovery. And then we looked at what services are currently available, and then we looked at other possible strategies or gaps. In the area of prevention, the needs were identified as would be expected. They need prevention and education about the dangers of opioids. We need increased prescriber monitoring and training. And people are concerned about targeting prevention activities to the appropriate groups, the at-risk groups. So this is what's going on now in this county, and it's probably not everything that's going on in the county. There is a robust system of prevention services in Orange County. The healthcare agency provides a variety of prevention services that promote wellness and substance use prevention, and that is done through both behavioral health services and also the public health function. They have a very good program. It's called the Alcohol and Drug Education Prevention Team, which has the wrong acronym up there, I think. But by doing that, that ensures that there is the complete spectrum of prevention services, from universal prevention activities, reaching out to communities at large, to more focused prevention activities, reaching those people who are most at risk for substance use. We have outreach and engagement throughout the homeless community and throughout the county. There is screening, brief intervention, and referral to treatment is a system called SBIRT, and that is a system that has been put in place at many primary care physicians' offices. CalOptima's network providers use SBIRT to screen people for problems. It's used at community health clinics, it's used at FQHCs, and it is really a good prevention focus to make sure that people who are really at risk get to the correct treatment source or intervention. The CalOptima, there are multiple coalitions and collaboratives in Orange County, and I can't possibly name them all, but they are very focused on substance use disorders and particularly opioid use disorders. That includes the Orange County Substance Abuse Prevention Network, SafeRx, the prescription coalitions, and cities and local jurisdictions have a lot of collaboratives that they've formed because they're addressing the problem in their local communities. There are also a lot of prevention groups that take place in colleges and also in schools, high schools and middle schools. And finally, there are strategies available to prevent drugs from falling into vulnerable hands. And these include drop boxes for medications, and I believe there's a sheet out front that lists all the drop boxes in Orange County. Some of them do take opioids, which is very helpful. And there is also the Monitor, Secure, and Destroy campaign that is being widely advertised throughout the county, and particularly in vulnerable areas. And also the DEA, of course, puts on take-back days every year. In the area of prescribing practices and monitoring, I don't think Dr. Condon mentioned this, but if you look closely at the maps in the reports, it says that there are 563 prescriptions per 1,000 residents of Orange County. But if you look really closely at that map, there are some areas in which there are up to 1,189 prescriptions per 1,000 residents in the county, in those areas. That doesn't mean they're getting high dosage levels. It doesn't mean they're getting prescriptions for 700 pills, but it does mean a lot of prescriptions are being written. So the medical community has really taken this issue seriously, as you can imagine, and has been making great strides in to reduce overprescribing. We have CURES, which is the California Prescription Drug Monitoring Program. And it was the first drug monitoring program that was established in the country. So we were kind of ahead of the game there. It has been evolving since that time. The coalition, the SafeRx coalition, which combines not only medical community, but prevention community and law enforcement and many other different groups, has been working very hard with the medical community to develop prescribing guidelines to prevent overprescribing and overdoses. And they are also educating the community on the threat of opioid overdose. CalOptima developed a data-driven system to reduce opioid abuse, and they are focusing on the prescribers, the pharmacies, and the individuals who are receiving a lot of prescriptions or a lot of pills. And it's very effective, and they're working to really lower the overdose rate of those on Medi-Cal here in Orange County. A new thing that I just heard about is that CHOC developed a pediatrician education program, and they're doing outreach to pediatricians' offices all over the county to advise them of what to look for among the parents in case there is a substance use problem so they can refer them to treatment. They're also teaching them about prescribing levels for adolescents in their care. And nationally, the medical curricula is being changed to include prescribing practices, effects of opioids, That has been a topic that has been generally kind of skimmed over, but those curricula are now being changed at a rapid rate throughout the country. And here in Orange County, we even have very committed doctors who will go to medical schools, and if they do not have a program available, he will do education services for free. That's Dr. Chakravarthian. He is very committed to making sure that medical students get the right information. So what are other prevention strategies? Well, we could expand the use of SBIRT. As I mentioned, SBIRT is used in medical facilities, but it could also be used in schools from middle school through college. You could have additional drug collection sites that are available year-round and that accept opioids. Now, there is a caveat on that it may require that be done in a hospital setting or other medical setting and would require certain certifications, but it can be done. And of course, we have to expand our social media and our printed campaigns to target specific groups. I know that Amy Buck of the ADEPT program is very excited about developing more of those. There is a national campaign going on. In fact, there are a number of national campaigns, one of which is being done by the Addiction Policy Forum, and they are putting out public service announcements and other information to inform the general public about this problem. And you could also include packaging changes in pharmacies. I think this was recommended by a student at one point in a work group, that the bags that the prescriptions leave the pharmacy in could also include a warning or some kind of educational information about opioids. And there are probably others, and those are what I want you putting your thinking caps on about. In the area of treatment, everyone expressed the need for timely access to affordable treatment services, from inpatient to outpatient. They also said they need co-occurring opioid use and mental health disorders treatment. And that the treatment providers actually ranked that as their highest, what they viewed as the highest need in Orange County. Across the board, people recognize that medication-assisted treatment would be beneficial to help people, whether they're detoxing or maintenance, to maintain their recovery. And of course, co-occurring opioid use disorder and medical treatment. So the current treatment services, we have in Orange County a continuum of care. For publicly funded programs, there is everything from detox through recovery and everything in between. And people are taking advantage and using those programs. They are limited, of course, by the size and the funding. But there are over 600 provider locations in Orange County that have been certified or licensed by the Department of Health Care Services. There are about 70 doctors, and this number fluctuates, so don't quote me on this, but there are about 70 doctors in the county that are certified to prescribe and administer buprenorphine. We have programs that are specific to the perinatal populations, gender-specific programs, and programs that focus on adolescent services. We require that in the publicly funded programs, and I know this is probably true in all private programs also, that evidence-based practices are used to best address the problem with which the client is presenting to the program. There are collaborative courts that have been very effective in diverting people from going to jail to getting them into treatment, and there have been great successes in the drug court for recovery. FQHCs, some of them are providing behavioral health services. We actually have a contract with an FQHC that provides Vivitrol, which is a medication-assisted treatment to the criminal justice population. And we have an MOU with CalOptima that has been recently expanded from just dealing with mental health issues to including substance use disorders for integrated care for our population. There are other treatment strategies that could be addressed. I have heard the comment that it could be treated as in a chronic disease model, much like diabetes. As I mentioned, it is a chronic disease. That we have increased availability of medication-assisted treatment in all treatment locations, and that we begin to initiate it when someone is in the emergency room or they're in jail and they haven't been released yet, to start their treatment at that point in time, to increase treatment in custodial settings, and also to we could use drug Medi-Cal funding or other funding streams to support additional services. As we get more funding streams for publicly funded services, we can provide more services with the combined monies that we have. Again, thinking caps on treatment. In the area of harm reduction, the needs that were identified were to take steps to reverse overdoses using naloxone, to provide clean needles and exchanges to reduce the transmission of disease, and also to have safe disposal containers for syringes and needles that are more available in the community to protect people's public health and safety. So currently in Orange County, we're very happy to have pharmacies that do provide and have available naloxone. You can go to a pharmacy without a prescription and buy naloxone. And CVS and Ralph's, which are two of the larger pharmacy companies here in Orange County, do carry it. Many first responders carry naloxone, and the treatment facilities make it available in case there is an issue while people are in treatment. There are volunteer activities that are taking place in Orange County. Naloxone is distributed to opioid users and to families and others by the Solace Foundation, and recently the county got a grant for 6,200 doses of naloxone, and this was provided to the Solace Foundation primarily to distribute to those in need. There is an Orange County Needle Exchange program through UCI, and they weekly provide clean needles and also provide safe disposal locations so that they can prevent disease transmission. Other harm reduction strategies would include expanding naloxone access to all first responders. Not all police departments have naloxone available. In the police departments that have naloxone available for their field officers, it's not provided to all field officers. Yet police are certainly one of the first on site in an emergency. We could provide naloxone to opioid users upon release from jail if they had been using opioids prior to incarceration, and also to emergency department visits who were treated for an overdose. Upon release, if they had naloxone, that could be a good harm reduction approach if they go out and use again. There are a lot of efforts right now to encourage doctors to co-prescribe naloxone with prescriptions for opioids. As you noticed from the overdose and death report, many middle-aged people are dying of accidental overdoses. And part of that is they're in pain, they don't understand, and if you can provide caregivers with the information, those lives can be saved from those accidental overdoses. We could do case management in the jails and in emergency departments. In some locales, they call this in-reach to like emergency departments. In some, it's called case management. It's an approach that provides people, if a person goes in with an overdose to the emergency department, there is a case manager assigned to them, usually a peer, to get them, as they put it, while they're still on that gurney, and encourage them to get into treatment and work with them and follow them and do warm handoffs to treatment. This is also being done in some jails in the country, not a lot of jails, but it is being done to ensure that people really get linked to treatment. And as I mentioned, we're not quite sure what happens to a lot of people when they're released from jail at midnight on a Thursday. But if there was case management occurring prior to their release, it could be beneficial to stop overdoses and to get people into treatment. We could establish substance use disorder intake and referral locations at proposed restoration centers. I don't know if you're aware, but there is a campus in the city of Orange that the county is seeking to buy to provide a whole range of services. And one of the services that could be there is to, when people are brought in by the police, if they're not linked to services right on site, that they have a place to recover from the effects of the drug and to get treatment referrals before they're released. And we need to educate users more about tolerance levels for drugs. The Solace Foundation does a very good job of trying to tell people, if you've been abstinent, don't use at the same level with which you previously used. And also I don't know if it's called a fast shot, but to do a slow shot to make sure that as they're injecting the drugs, that those are injected slowly to help them realize if they're having a problem. In the area of recovery supports, everybody in every group says the needs are exactly what everybody in every group in the community, where whatever having to do with drugs or not having to do with drugs, to be successful, to feel that you can cope with the situations going on in your life, people need housing and safe environments. They need access to employment opportunities, and they need community supports to help them in their recovery. Currently, there are aftercare programs and alumni groups that are offered by treatment providers throughout the county. There is also currently a recovery maintenance program that is available to people coming out of treatment. And these programs help people by providing individual counseling, peer support, discussions, linkage to appropriate services out in the community that they may need, such as finding a doctor, looking for housing and those types of services. There are, of course, 12-step groups, both AA and other recovery groups. There are sports and exercise programs such as Phoenix Multisport that provides a location for those recovering to be in a community and also receive the physical sports that may help them. There are recovery residences in Orange County and that are usually privately operated, where people can go and live either while they're in treatment or while they're after they've completed treatment. This is usually a housing situation, and they are privately operated. And programs such as OC REP, or the Orange County Reentry Program, does a very good job at providing job fairs, which also helps address opioid users and other substance use disorders. As far as additional recovery support strategies that could be used, it could be possible, and in some locations, recovery residences for housing are being used while people are actively participating in treatment. So before they've completed their treatment, they are living in a safe environment as long as they actively participate. We could also look at utilizing funding more broadly. And there is a drug Medi-Cal implementation plan that's in process, and using drug Medi-Cal funding, as I mentioned, will free up other funds, and that could be very supportive of recovery services and enable the recovery programs to really offer individual counseling and other services that will help them in their recovery. And of course, having more peer support programs. Peer support anywhere you read about anything, and I think all of you know if you've had a problem, who better to talk to than someone that understands the problem. And peer support programs have proven very effective throughout the country. So we'd like to see more of those. So that's what we've learned by our surveys, by focus groups, by going to different opioid events. These are the strategies. These are components of plans that are being written all over the country. So what we'd like to do is to hear from you. We have speaker cards. They are color-coded by prevention, harm reduction, treatment, and recovery. And if you would like to speak on any one of those topics, please fill out a speaker form, and please feel free to share that information with us, because the more information we get, the better plan we can develop for the Alcohol and Drug Advisory Board and for the county. So if you'd like to, would you like to take a little break before we do speaker comment? No? Yes? No? Okay, you have 2 minutes. How about 5 minutes, and then we'll go through the speakers. We have some people that would like to make public comment. What we are looking for is potential strategies that we haven't seen or thought of that may be helpful as we proceed on this development strategic plan. So I'm going to start with prevention, and you can come up and make your comment, and I'm going to try to read people's names. So if I mispronounce a name or can't read it, I'll let you know. So if the following people could kind of come up, Victoria Weber, Mary Ann Long, sorry, you'll be second, and then Stephen Lambert, or Stephanie, depending on how you pronounce it, Stephen. Okay. If you'll come up in that order, and feel free to make your comment. We will be keeping track of them, so that what we will do is take those comments back to the Alcohol and Drug Advisory Board and look at where they would fit into the strategic plan. Okay, so Victoria.
Hi. So my biggest question as someone who's in this transitional age youth range is, what is Orange County doing to target the alarming, like almost twice as much percentage of this issue affecting this age range? And like I saw a lot of different initiatives for a wide range of population, but also, why is it for transitional age youth, it's 100, like, it's just such a high statistic, so I just wanted to know, like, what's on your guys' docket for targeting this age range. And then secondly, in terms of, like, collaborative courts, too, like, with youth, how are you guys working with, like, the OC justice system in Santa Ana, with those kids who are involved in drug court, or like what's going on with like alternative sentencing and stuff like that to prevent them from going to jail, which everybody knows like what happens when you send the kid to jail. So that's, it was more so like, what are you guys doing versus suggestion. But yeah, wanted to hear that. Thank you.
Hi, thank you for your comments. And a few concerns. They're saying like friends was the most popular way to get drugs rather than from a doctor. And so sometimes I feel like the emphasis isn't really on the streets, it's in the medical field. And the police, what I've heard is the police are backing off on arresting people who are exchanging some drugs. There's too many other things to do. It's not as important anymore because there's so much of it going on. I think that needs to change, that if you see something happen on the street, I or in Ireland, they have signs all over the place saying, if you see somebody buying drugs, call this number. We put a reward for it. So that gets this off the streets. Also, why is it, when I was told that somebody was, a friend of mine was going to jail because drugs, or were going to tell them about their son was going to report it. They were told, don't report it because when they go to jail, you're going to get more drugs. You're going to get a lot of drugs in jail. So why go to jail? Don't report your son. So that was very disturbing to me also. And of course, I think we need more like community education with families, with parents, with kids, you know, at community parks, at different places to come. Yeah, it's hard to tell where it's happening and where, you know, I was shocked at how much it's happening in Irvine. And so if I had known, I think I could prevent some problems too. So I think parents need to be educated. Thank you.
Hello, my name is Steve Lambert. Hello. And I'm from the Orange County Department of Education. I want to talk briefly about some of the stuff that we're working on and maybe some areas that could use some expansion. So in my department, I do a lot of staff trainings and parent workshops with different schools and districts about current drug trends, especially prescription drug use, expanding the Monitor, Secure, Destroy, the awareness of that campaign as well. I'm also partnering with some of our adaptive providers to work in San Diego and SBUSC, Southwide Valley, to do more work there with both the youth and with the parents. And I'd like, you know, honestly, there's only 2 districts out of 27 that I work with, and I would really like to see an expansion into other districts who could receive that kind of support. That would be fantastic. I also collaborate with another adult provider, Friday Night Live, who empowers youth to youth-driven prevention projects, and that's been fantastic. So kind of like one of the strategies I saw earlier, that pharmacy merchant education or providing prevention education materials on the pharmacy materials, that could be an interesting way, an interesting avenue to get that across. I would love to reach more schools and districts and move toward more evidence-based practices when it comes to prevention. A lot of the districts and schools I work with, unfortunately, historically have kind of a narrow view of what prevention is, and so they think if we have one assembly of the year, then that'll take care of prevention. You know, and that's kind of how it was back in the day, but we really moved beyond that. So trying to push toward more evidence-based curricula in schools. We do in our tobacco use prevention education program, we do provide that to a number of districts, and it's highly effective, proven effective. I'd like to see an expansion of that as well. And also to kind of structure things and provide multiple tiers of supports for the youth, whether it's primary prevention or intervention, early intervention, or treatment, referral, and recovery. So that's all I've got.
We have one more speaker who wanted to comment on prevention. That is Jade Palmer from Palmer House. And after that, you also wanted to comment on treatment services, correct? Okay. And following Jane, could we have Tamara Jimenez and Rick Cortese? And then we had somebody from ACNET, but they didn't put their name. So we could have those ready and lined up to talk. Thank you.
I'm a parent of a heroin addict. It's been a 5-year road. It's been 6 treatment centers. I've been at hundreds and hundreds of parent meetings. I've given presentations to parents. Quite nervous, sorry. And I've spent hours and hours educating myself on the subject, and I've got so much more to learn. As far as prevention, while I've convinced myself that I didn't cause it, I can't cure it, and I can't control it, I'm convinced that I can help my son in many ways. The prevention part, though, I've questioned over and over and over in my life. what I could have done, if anything. A friend of mine was an addiction specialist, a physician. He said there's no evidence that anything can prevent drug use. I just can't believe that. So there's a book called Clean, and if any of you read it, it's a fabulous book. Everybody should read it. And it's by the gentleman who wrote My Beautiful Boy. And it's his views on drug use in the country, the history of drug use, possible solutions, and where we are and where we come. In it, he suggests something that nobody mentions on prevention. And, we've got to educate our parents. I've done presentations to parents, and 5 people show up in North Linda. Advertise like crazy, 5 people. But that's okay. If there's one person to be with. But in any event, let me shorten this. This is the thought they had. Because most parents, myself included, did not see what was happening until they're addicted to opiates. Didn't see it. Couldn't see it because I don't know. I didn't know. So this is his thought. And just put it in your mind, I'm not even sure it would be effective, but I'm not sure that it wouldn't. What if parents at a certain age with their kids said, I love you, and I don't want you ever to get addicted to drugs or abuse drugs because it's dangerous and you know that. So I'm going to buy tests. I'm going to get them online, 100, 200 tests. I'm going to share them with my friends, the other parents, and we're going to test you randomly. So that possibly, just possibly, that one kid that goes to the party and his friends say, hey, this is Xanax stuff, feels good, may say, I can't. My mom is such a pain. I'll go home and she'll test me and then I'll lose my car, I'll lose my privilege, I'll not be grounded, blah, blah, blah. I don't know if it's going to work, but no one's suggesting that maybe parents can do something to prevent use at an early age, because I'm convinced that the studies don't show what the 19-year-olds think about drug use. The heroin users that are 20 years old that are in treatment for the second time. The 23-year-old, like my son, has been in 6 treatment centers. Glad to say he's 7 months sober. And he's been sober more than he's been using. But prevention is a huge part of the story, and we don't have answers. So I'm just throwing that out as a possible suggestion that we might want to pursue. Thank you.
Hi, it's Carmen Jimenez, and I'm going to go after the big elephant in the room, since in the report it says the number one barrier is cost or lack of insurance. So I know that the board does a tremendous amount of work. You guys work really hard, and I know a lot of the people at the county are working really, really hard too. But Orange County has close to $700 million from the fiscal year 2016-2017 that was not spent. So I would like to know how you guys are going to get the county board of supervisors to use that money so that we can provide all of the different array of services, because that's what needs to happen. We have the money. We're one of the wealthiest counties in California. So how are we going to do that? A lot of us go down to the board of supervisors meetings and we say things, but it gets ignored. So it would be great to get people that do work for the county to, address that. What are you guys working on? Are you having conversations with the supervisors? Another thing is, Anaheim adopted the Drug-Free Anaheim program, which is from PARI, the Police Assisted Addiction Recovery Initiative. And I want to know if the county is looking at that as implementing that countywide, because that would be, I think it would be really good.
Hi, I'm Michelle, and I'm from the Orange County Needle Exchange Program. So on the report, it said that the Orange County Conviction Program was operating. Unfortunately, at this moment, we're not operating. We were denied a permit to operate the Santa Ana Civic Center. We would appreciate the county's support in any form or with providing a new location to operate so we can continue preventing the spread of bloodborne diseases and saving lives. Thank you.
Okay, so we had people that wanted to talk about treatment, and I don't know if they want to come up and speak or they were just making comments, so I'll call names. Edgar Villa, Joe Milligan from Beginning Treatment. Do you want to speak or? Okay. And then Leanne Corral. Is she here? Okay, so if they'll come up in that order, please, starting with Edgar. Villa.
Hello, my name is Edgar. I'm from Search of the People. And one of the things that I noticed was a lack of barriers which is treatment. And I don't know if anyone's aware of this, but we're a very my health service clinic. And most of our individuals are uninsured, 60% of them uninsured. But we actually have a medication treatment program. We have a capacity for 130, 200 people we serve, and we only have maybe 50% of that. We have a grant to provide services in behavioral health. And one of the things that have been really helpful for us is educating our providers how they can co-mutually advantageous financially if we start doing experts educating them. So one of the recommendations I make is, as providers, as therapists or counselors, educating the providers, the prescribers, that if you allow me to be part of the team, I can go in there, help you with the expert assessment. You could bill for it. You know, we could actually work together and help each other. But one of the things I want to say with Serve the People is that we want clients. We want to help the community. We're really out there to serve and help wherever we can. So if we have anyone that is uninsured, that can't pay for their medication for Suboxone incidents, we actually have a grant to be able to provide those services. So I have some flyers. We want to expand more. We want to do outreach for the homeless population. We just want to be known that this is where we're providing that. For anyone that needs any help, refer us to us. We do an ASAP assessment. They meet with the therapist, with the counselor, and with the prescriber. So I just want to let you know that we're here to help whoever needs help. Collaborate with any prescriber, collaborate with any agency out there. Thank you.
Hi, my name is Geoff. I'm with Beginning Treatment Center, one of the founding partners. And I can talk to you all day long about the greatest public health crisis since AIDS. I can talk to you all day long about the national and local effects of this crisis, but we're talking about Orange County. I don't know if anybody here has seen the movies, the documentaries Behind the Orange Curtain or Overtaken. Well, we know about those. Those came out in 2012. There was a crisis then. Around 75 people were dying a day of of opiates back then. It's 140 dying a day. What's happened in that time? Well, it wasn't affecting everybody. And I can talk to you all day long about what the real effects are. In fact, Goldman Sachs and Janet Yellen of the Fed have come out and said that this opioid crisis is costing this nation right now perhaps 20% of our gross domestic product, because we can't reach full employment. Too many people are high. They can't pass the drug test. This is amazing to me that we've gotten to this point. While we sit there and treat people all day long, and it just gets worse, and we talk about it, and it just gets worse. And now we're talking about it, and I appreciate that. I really want this to happen. I can talk all day long about medication-assisted treatment, but it's not just opioid replacement therapy. But what I can talk to you about is that the treatment model is going to change, and it's changing now to a chronic disease model. It's an important thing. It's just been in the last year that the American College of Physicians has taken the position that addiction is a chronic medical condition, and the American Medical Association has just in the last year recognize addiction medicine as a specialty. Everything's changing, but it's the biggest thing that we need to do is get together and talk on the local level, on the national level. The problem is the stakeholder. We talked about the stakeholders earlier. Academia, government, the pharmaceutical industry, the insurance industry, medicine, behavioral health. They all say this is a terrible thing and we want to do something about it, but their agendas compete. And they can't get on the same page. And it went from 70 people to 140 people dying a day. It just keeps getting worse. We need to come together and work together. And I'm talking to you about what we can do about Edgar, if he hasn't left, because we want to have that connection between providing service to people who can't afford it and providing service to people who can't. Everybody needs a service. This is, I get passionate. I'm going to let you guys go and argue, so I'll stay here all night. But I'm willing to talk to anybody here. You can always find me. My name is Joe Milligan, Beginning Treatment Centers. We're right here. We've been here a long time.
Hi, I'm Leanne Corral. I am a Al-Anon and Alateen member. And 7 years ago, I lost my son, not to opioid addiction, but to suicide. And I have been with Solace. Margie and I have worked together on several things, including like Sober High School. So, but I will get to this question that we kind of came up with. We all have heard of someone going through treatment multiple times. Someone might say that these loved ones are broken and they are just not getting it. But could it be that the treatment programs and the industry itself is broken? And shouldn't we be looking at what is working and what is not working in the treatment program system? And I also saw a thing on, I believe it was 60 Minutes, on pilots. Their treatment program had like a 0% relapse rate. Why? Because they want to fly again. And so, as we know how hard it is just to get people to go to rehab or go to AA and to admit that there is a problem, I would offer for you all in a solution, which is understanding what recovery is. And that's in the Al-Anon family groups, which you go through the same 12 steps, the same 12 of recovery, the same 12 traditions, and the same 12 concepts of service that have definitely saved my life. And there's a parent meeting that we have in Newport Beach that meets Saturday at 8 o'clock in the morning, and there's about 200 people that consistently show up to that meeting. Many of them, like myself, I think because I keep going, because a lot of people ask, why do you keep going? Because your kid is gone. Isn't that it? No. Recovery is recovery. It's all of us being better people. It's just like New Direction saying that it would, we need to be on the same page. And so all of this, these people as well have used recovery to help them in pursuing their dreams as well. So I will talk a little bit about that when I get to recovery. Thank you.
Okay, the last three speakers, Leanne, you could have stayed up here. Speaking on recovery supports are Leanne, Kristen Pankratz, and Ramon Hernandez. And those are our last three speakers, so if you come up in that order, please.
Hi, Leanne. Okay. And another thing is, too, is I feel like I'm in a recovery program, and that's so weird to say because I'm not sober. I work with Alateens. Alateen friends and families are all affected. The Alateens that I work with usually have brothers or sisters or family members that are addicted to or have some sort of drug treatment program. These kids Some of them will need to become addicts themselves, because everybody in high school uses drugs. I'll let you know that. And marijuana is a green vegetable, according to them. And so, therefore, that is kind of how that goes. A lot of cutting, anxiety disorders. I don't know if any of you have seen Generation Found, but I have seen the sober high school in Houston, Texas. That is amazing. So if any of you can get part of that Generation Found, that would be awesome. Because my Alateens, these are people that are kids that are just affected. They can't go to school because of their anxiety, or they're and saving their parents from committing suicide. So also, go on the Al-Anon website and look at the survey. It helps us, parents, physically, mentally, and emotionally. And there's stats to that as far as the survey goes. So I really encourage that you should look at that. Thank you.
Good afternoon. My name is Kristen Pancras. I'm with the Depression and Bipolar Support Alliance, Orange County, and I'd like to share a treatment strategy. We have a free dual diagnosis support group at St. Joseph Hospital in Orange. Meets every Thursday at 7 p.m. I have newsletters with information on page 6. So this is a group for individuals with a mental health condition and a co-occurring substance use disorder. It's free of charge, as are all of DBSA services. The beauty of the group is that we understand both issues, both the mental health conditions and substance abuse disorders. And some people have told me they've gone to AA and they don't feel comfortable talking about their medications. So this is a place where you can discuss both your mood disorder as well as substance abuse disorders. We're happy to sign court cards. Just an interesting note about the effectiveness of DBSA groups. DBSA National conducted a survey of group members, and among their findings were that people attending the group for a minimum of 1 year were more likely to follow their treatment plans and were less likely to be hospitalized. So please refer your clients, please come to our group. Our website is www.dbsaoc.org. And if you would like a newsletter, I have them. And our newsletter is appropriately named The Roller Coaster Times. Thank you.
Okay, hi, my name is Ramon Hernandez. I have over 7 years of experience with DUI programs, working specifically with Academy Defensive Driving, but also I work with a nonprofit called Rat Park, okay? And this is where I really want to hit the head on this one. We're having issues in the long-term preventive care recovery programs. There is 90-day programs and you're done. There's a 30-day program, you're done. There's no welcome to the world again. So with Rat Park, what we're trying to do is we're trying to promote a social, human, positive connection. And what we're doing is we're trying to remove the stigma out of the addiction part of it and just come join us, okay? We do music events, festivals, fitness events, where we get people together without saying who you are as far as you're an addict, you're an alcoholic, you belong in that corner or in this corner, right? There's a lot of these programs today. If you're part of AA, which is a great program, but the moment you remove yourself from AA, you're back to using again, okay? You're not back to that normal human being. So what we're trying to do, we're trying to encompass everyone to come together without that stigma, enjoy a social event with us, and let's create that connection. As an example, we have the next event we're planning together. It's going to be a fitness, 5K, weightlifting type of event. We're going to have music. We're going to have food, vendors, trainers, coaches, and we're going to have an AA representative. We're going to have a MAD panel representative. We're going to have someone else to come in here and represent us, okay? So what we want to do is join us, check out our website. Our website is ratparkfbn.org, AARATPARKFBN.org, ratpark.
Okay, we made it. Thank you so much for everybody's courage to come up and speak in front of other people. If you do have things that have come across your mind that you'd like to suggest or advise or whatnot, one more time, I'll give a little plug for the Drug and Alcohol and Drug Advisory Board for our county. The meetings are the first Thursday of each month, 9 o'clock, Hall Administration Building. It's in the main, public hearing. So please go to the website, take a look, or just show up and wander around, and we'll find you there in the Home Information Office. So just one little, or just a couple little things that kind of came up. One was a question, I can't remember, I think it was the very first speaker, had asked about pay and those kinds of things. Probably we could do a whole afternoon session, or the county could, around all the different programs and things that go into specifically to pay. But just so that you leave with a referral person to ask all those questions with. I know Brett O'Brien is here. If you will raise your hand. That way, can you see me, Brett? Oh, no, you're texting. That's all right, it's a generational thing. I was just tweeting over there a minute ago, so I understand. Brett, I'm sorry, you raised your own. Brett's he's one of the managers for the county who could help you get some of the answers to your questions around tech. So I just want to make sure you saw that connection. Okay, great. Lastly, the kind of general statement or general rhetorical question maybe on how to influence how things are funded or how money is spent in the county and so forth. I just wanted to say that, number one, the publicly elected officials who make decisions about things are influenced primarily by the public, right? That's who they're accountable to, the voters, people who vote them in. So if anyone, any citizen wants to have influence about how things are said and done, then they need to go and speak directly with, or either directly themselves with their representatives, or through an advocacy group of some sort. One advocacy group, although it's maybe not an advocacy group, would be a specific county advisory board that you can give input to, and then the county advisory board then can come together, and if there is consensus among the board, then would issue some advice to the county about what they can consider doing. But I just wanted to make mention of that, that if the homeless issue, for instance, that's been going on in our county, if the homeless issue has this many advocates that have been coming to the table for years, and now we have how many shelters are being built, and all kinds of various things, good, bad, or different. I'm not making any judgments about any of it. But that was, frankly, as a result of public advocacy and public pressure or public dialogue around the topic. If we had a similar kind of dialogue around this issue in particular, maybe we would have some different dialogue in our community as well. You hear kind of where I'm going with this? So anyway, those were kind of my closing remarks, and I'm going to let Mary take us home.
If I need help. Thank you again so much for coming, and for those of you who have stayed for the very last minute, really thank you. I really wanted to just take a moment to thank the speakers. We don't have time today to go through each and every one of your comments. I know Geoff did on the TAY resources, so you can go get your info from Brett. But what I want to encourage you all to do is, if you have a specific question or need more information, in addition to the Alcohol and Drug Advisory Board, we have set up a special email. It is opioidinfo@ochca.com. I wrote it down so I could look at it, but then I didn't look. Opioidinfo@ochca.com. You can send that email. We will definitely receive it, and we'll respond to your question as we can. So, but also, please know that the Alcohol and Drug Advisory Board always has a time for public comment. You can also
submit in writing or show up to their meetings. And the last thing I wanted to say, because of course we do provide at the county prevention, treatment, recovery services. We have so many programs that it's hard to know all of them. So I encourage any of you that either need or know someone who needs a program to put into your phone, because you've all got cell phones, 855-OC-LINKS. You have to figure out what the number is, and I didn't bring my phone. But truly, you can call that number Monday through Friday, 8 to 6. Talk to a clinician who can help you figure out what is available and what the needs are. And it really is one very important step that we're taking to address all of the behavioral health, mental health, and substance abuse issues. Thank you again so much for coming. And we will look forward to getting you the report out. Thank you.